We are going to start with the first guest today, and I'm going to turn off my sharing for just a minute so that you can see Jessica, but she's going to be sharing with us a little bit about health administration and her pathway to get there, which I know also includes some physical therapy, I believe. So I know we have students interested in finding out about that as well.
Hi, is it all working good?
It is. Mm-hmm.
Good. All right. Yep, I'm Jessica Atkinson. I am an administrator at Woodside Senior Communities. I am a CBRF administrator, which is a community-based residential facility, or one of the licenses of assisted living that you can have in the state of Wisconsin. A little bit about Woodside. We are an 18-acre campus in Ashwaubenon. That is our front entrance to our main nursing home there. That is actually our entire campus. So most people don't realize how large Woodside Senior Communities is. So we are an 18-acre campus. We are a nonprofit organization that is run by an executive team, which consists of myself, the administrator of our nursing home, our finance director, and our HR director. And then we have a board of directors that is made up of our fellowship churches that also support our campus. So we have the full continuum of care for seniors. We have independent living, assisted living, and nursing home. And we actually have one of the largest short-term rehabs in our area. So we work really closely with a lot of the hospitals on short-term hospital outpatient stays. So after someone's recovering from a surgery, hospital stays are typically getting shorter and shorter. And so then those patients are transferring over into our rehab, where we then get them better and get them back home. And then we have the largest CBRF in the area. So my career path started out, I went to Ashwaubenon High School. There I was a student athletic trainer. Ironically enough, Jason Helgeson that you mentioned, that's going to be speaking in October, was the lead athletic trainer at that time. So it kind of shows you how small the healthcare world is, even all the way when you're back in high school, how it makes a difference. I did the student athletic training program, which then also helped me be able to take general classes at NWTC my senior year. At that time, I had thought I wanted to be a licensed athletic trainer, and so I was planning to go to UW Oshkosh. When I went to NWTC to take my some gen classes that I was taking, I found out about the PTA, the Physical Therapy Assistant Program. And it really appealed to me for a couple of reasons. One, it was a 2-year program, which I found appealing because I was excited to get out into the workforce. 2, it actually paid more than the licensed athletic trainer. And I really liked the rehab part of doing the athletic training and learning kind of how the body worked together and the whole kinesiology of it all. So it definitely appealed to me with that. So I switched and decided to do the PTA program. When I graduated as a PTA, my first job was in an outpatient peds clinic. So I kind of thought I wanted to be in the opposite end of the spectrum, working with kids. As much as I loved that, our clinic kind of started branching out, and we did more outpatient into some of the home, like with home health agencies, and we did some occupational health. And my boss at the time kind of kept pushing me out into the different things that we were branching off into. And that really got me a lot of exposure into different aspects of the PTA field. And then that's how I actually ended up at Woodside in their nursing home. So I went over and was working in their short-term rehab as a physical therapist assistant. I was doing that for about 6 months, and they asked me if I would be willing to start filling in on Fridays for our program director, because she was working 4-day work weeks. And so at the time, I just said yes, didn't really know what it entailed, and started doing that. And I really liked it. And then when her position became available, they asked if I would be willing to step in and be the program director. So at that time, I ran the therapy for all of the short-term rehab. So all the physical, occupational, and speech therapists, as well as the PTAs and the COTAs that worked in that department. And about 4 years ago, our CBRF administrator retired from here. And at that time, the executive director that was in place on the campus had asked if I would be interested in moving into a higher administration role here to kind of help with some of the strategic planning and, creating more wellness and things like that across our campus. So at that time is when I switched over into a CBRF administrator role. Those are just some fun, cute pictures of seniors. Who doesn't ever want to see those, right? So what is a day in the life of as a healthcare administrator? Honestly, I don't really think there's such a thing as a day in the life of if you're in healthcare administration. It's constantly changing, which I really like. It's very fast paced. COVID has definitely shown us how much everything changes. You have to be really able to just kind of take on new challenges as they're coming. We're responsible for producing all like the policies, protocols, the different procedures that our staff use. So when COVID came, obviously that was a huge thing. We got to work with a lot of different departments like public health, the state, UW-Madison, establishing, good PPE policies and infection control policies and procedures. We're responsible for the communication with all of the staff and the families, making sure all of the regulations are being followed, that we're complying with all the governing authorities that oversee us. So we have, CMS, the Certified Medicare Services, Department of Health Services, Public Health, all of those entities. I drive the quality improvement process program that we have for the assisted and independent living. And that's really exciting because we get to find things that we think we could do a little bit better at, and then establish small work groups and kind of figure out how we can constantly be improving what we're working on. And then we do a lot of community outreach. So the other administrator and I do a lot of different lunch and learns. We do job fairs, get to do a lot of volunteering. That's the part that's probably one of the most exciting things that I like to do in our role, is getting to network and get out and figure out how we can make those connections in our community. NWTC, actually, we partnered with them about 2 years ago now, where we started having CNA classes on our campus. So doing things like that can really help benefit the community and get people in our doors at Woodside. I love being able to find those connections and figure out how we can get everybody benefiting from those connections. And then working with our executive team, we do all the campus initiatives. So working on the partnerships with the different hospital systems. We're part of like the Bellin ACO, it's called. So we work with each of the different hospital programs and working on those, working on changing of our buildings. So we're constantly adding on. We actually opened a new memory care yesterday on our campus. So as we, do market studies for what is needed in our area, we get to kind of analyze that and work with different consulting firms to figure out, do we want to build? Do we want to add on? What kind of need is in the community that we can try to fit into and help with. So that's always really exciting. And then working a lot on the staffing structures for each of the departments. So, we have nursing, there's life enrichment or activities, we have dining services, maintenance teams, IT. So getting to work with all those different staffing structures is always kind of exciting too, getting all of those out. And then we're in charge of driving all the construction and as it happens on the campus. So as we were building this memory care and we just remodeled a bunch of our buildings, we got to be actively involved in, making sure that it was designed for who we're, targeting our residents, making sure that everything from the flooring to the layouts of the rooms, that it fits the easy stands coming in and that the staff have accessibility to things. So it's really neat to be able to partner with those firms and kind of get the different healthcare entities and the construction teams in the room and figure out how we can build things to really meet the needs of our residents. Recommendations that I would have for people that are looking into going into, honestly, anything in a healthcare field. Things that really helped me, one was the student athletic trainer program. I know a lot of the high schools still do have that, but I think any involvement in something, even if it's just a little bit into what you're looking into, can really help you kind of fine tune what you want to get into. Taking medical terminology classes, I think, is huge. Once you kind of have that basis of medical terminology, I feel like that really helps then the other classes that you take come a lot easier. So, your science classes, your, anatomy and physiology, kinesiology, biochem, all of those, I think as much of that as you can get in high school to help you kind of prepare for them when you get into college, make a huge difference. Shadowing, I can't tell you how many people I shadowed from every different healthcare entity, from x-ray, ultrasound tech. I knew I wanted to do something in healthcare, but I didn't know what, and that really helped me narrow it down. And then getting a job now as, a dietary aide in a healthcare entity or working as a personal care assistant. We have a lot of high school kids that actually work on our campus. And I think that exposure is really good. And then I always say working in the service industry in general, some of the most important skills that I think I had to learn for my role that I'm in now, I learned as, a bartender and a waitress, or working in dietary departments, learning that customer service aspect of it and just having all that exposure to different people really helps. And then, the biggest thing I always say is never say no to an opportunity. When I first was a physical therapy assistant here at Woodside and they asked me to start covering on Fridays for the program director, a lot of people on our team thought I was kind of nuts at the time. I thought I was too, because they were like, we have this great opportunity. We're not going to pay you any more for it, but you get to do another job on top of yours on Fridays. And it sounded kind of nuts at the time, but it gave me an opportunity to see an entire other side of the business that I was working in that I didn't even know, I didn't know it existed. So having that opportunity opened so many more doors for me going forward. So even if you don't think it has anything to do with what you're planning on doing, I just always say never say no to an opportunity, because I think that that's huge.